Welcome to this symposium, which has a dual purpose: to celebrate LSHTM's partnerships across the world and to mark the handing over of school leadership from Professor Peter Piot to Professor Liam Smeeth. Peter has been our director for 11 years, and I've had the great privilege to work closely with him over those years. Back in 2010, when Peter joined the school, our research collaborations across the world were a huge strength. An especially important feature, which continues today, is that many of our academics were based overseas with local partners, rather than working out of London. Peter brought with him extensive global networks, which have greatly expanded our horizons. These are not only with research institutions, but also with global and national public health bodies, research funders, and development agencies. In developing the school's first strategy, we put partnerships centrally within our mission statement. To improve health and health equity in the UK and worldwide, working in partnership to achieve excellence in public and global health research, education, and translation of knowledge into policy and practice. Over the last 11 years, our partnerships have evolved to the point where they are embedded in how we function as an institution. They are core to the development of our UK and global reputation and to our contribution to the world. One of the most significant developments under Peter's leadership, which I want particularly to mention, has been the joining of the two Medical Research Council units in the Gambia and Uganda, where we are in partnership with their respective governments. The speakers in this symposium have been asked to reflect on various dimensions of partnerships, and I would like to thank them for taking the time to record their contributions. The symposium will end with some concluding comments from our new director and chairs of our court and council. I look forward to what should be a really interesting event.
Three days after arriving at LSHTM, in my first address to all staff, I asked, are we a London institution with global activities, or are we a global institution with a London head office? That question is as relevant today as it was 11 years ago. Over the last decade, LSHTM has more than doubled in size in terms of staff, income, and outputs. However, that is only part of the story of enormous growth, which has been largely driven by new partnerships and alliances. And our mission statement is very clear. It says explicitly that we are to improve health and health equity, working in partnerships. Now, that doesn't mean that it always works. And failure has happened, but failure should be more acceptable culturally in academia, as long as we learn from it. Global and public health have been in profound transformation, and the COVID pandemic is actually accelerating this change. LSHTM must remain at the forefront of this transformation. The changes are as much about the what as about the how. In terms of the what, it's increasingly clear that we are entering an age of pandemics, with COVID-19 being only a first major crisis. And climate change is accelerating and is also a major crisis. Chronic conditions are spreading like wildfire across the world. And let's not forget, of course, a huge unfinished agenda of maternal and child health, AIDS, TB, malaria, and we still have a very long way to go to ensure universal health coverage. But how we work and with whom must also change and adapt to the realities of societies. The emergence of centers of excellence in health and science beyond the Western world and Japan offers real opportunities for more equitable partnerships. And these new geopolitical realities are the surest route to equitable partnerships and so-called decolonization of global health. Because as we know, those who control the money have the power. We must also ensure that the formidable scientific capacity in many countries, including in the UK, be strengthened, and that their products become accessible to all in need, such as dramatically exposed by the lack of access to COVID-19 vaccines in much of the world. Today's symposium is about progress and challenges on equitable partnerships involving LSHTM. And good practice, of course, starts at home. And let me give you 5 examples of partnerships. First, our default approach is to work across disciplines to tackle the often very complex problems in health. Means that our social sciences must be as strong as our basic laboratory research and our epidemiology and clinical work. Secondly, we must embrace sectors beyond health, as often key interventions to improve health come from other sectors. One recent example is the launch of the Global School Health Research Consortium, engaging the health, education, food, and agriculture sectors. Thirdly, besides embracing diversity of all kinds as a principle of justice, we should also see it as a way to ensure innovation that is relevant to all across the world. Fourth, we should ensure that we are relevant for policy and embedded in action on the ground. My proudest moment at the school was undoubtedly when in September 2014, following an email to all staff, about 400 colleagues signed up to volunteer to fight Ebola in West Africa. I could not imagine a more powerful illustration of our ethos. And out of this grew the UK Public Health Rapid Support Team, a partnership between the government and our school. And our work on the COVID-19 pandemic amply illustrates this principle in the UK, in Africa, worldwide. Lastly, in order to fulfill our mission of improving health worldwide, we cannot stay in our ivory tower of academia. We must get out of our comfort zone and work directly with governments, civil society and community organizations, and business. Partnerships will undoubtedly continue to be a hallmark of our school. We will hear the perspectives of 4 eminent speakers engaged in partnerships with our school across the world, plus my successor, Professor Andy Haynes, a world authority on climate change and health. Together with pandemic preparedness, climate change and planetary health are the focus of our major new philanthropic fundraising campaign to secure the future of the school. In between the keynote speakers, we will hear short messages from a wide range of partners, many of whom are alumni. I'm very grateful to all for their time, commitment to LSHTM, and friendship. It has been an incredible privilege to serve as the 15th director of the London School of Hygiene Tropical Medicine. And I've been lucky to work with such committed people. There will be other opportunities to thank all those who have made my tenure and my day-to-day work so rewarding. This is nothing but a remarkable institution, more needed than ever, with unmatched, inspiring, and dedicated staff. An equally bright and relevant future is here to come. I'm pleased that the school is in capable hands with my successor, Professor Liam Smeeth. Good luck, Liam. Count on me, and enjoy the symposium, all of you. Thank you.
My dear friend Peter, dear colleagues and friends, it's no exaggeration to say that Peter Piot is an icon of global health. From his pioneering work on Ebola 40 years ago to being the founding executive director of UNAIDS and his leadership of the London School of Hygiene and Tropical Medicine, Peter has left an enduring legacy in the lives of the communities he has served, the students he has taught, and the people who have been lucky enough to call him a colleague and friend, including me. Peter, we have known each other for many years, and I have always admired not only what you do, but who you are. As a proud alumnus and honorary fellow of the London School, I want to thank you on behalf of all alumni for everything you have done for our great school. Much gratitude and much love. Peter has made collaboration a priority in the school's current 5-year strategy to deliver research that is up-to-date, relevant to global health challenges, and geared for impact. WHO is proud to be a partner of the London School of Hygiene through our 4 WHO collaborating centers for sexually transmitted infections, gender-based violence, vaccine surveillance, and most recently for climate change, health, and sustainable development. Peter, well done. We're proud of you. You will be missed, but I know that this is just the beginning of the next chapter, and that wherever you are, you will continue to contribute. I look forward to working with Liam and with the London School to build on your legacy for the health of the world's people. This is not goodbye, Peter. It is see you soon.
Dear Professor Piot, ladies and gentlemen, when we are talking about the pandemic, it is usually hard to find good news. But when we look to science, this picture is completely different. If there has been one bright spot in this crisis, it was the unprecedented level of scientific collaboration. Thousands of dedicated scientists have worked day and night to analyze data, to advise policymakers, and to develop and test vaccines as well as medicines. They have saved countless lives, and I thank them all from the bottom of my heart. But there's one scientist, one expert, one colleague, who has been for me the face of this European global and scientific community. And that person is Peter Piot. Professor Piot has been my advisor since the beginning of the pandemic. I could not have had a wiser and more helpful virologist to accompany me through these challenging months. Peter Piot embodies the best of science. He is a shining example of the positive contribution that a scientist advising politicians can make. Today, I want to thank you, dear Peter, for the quality of your advice and for your commitment to our European and global approach in fighting this pandemic. Working with you was always a pleasure. Whenever I had an urgent question, a short text message was enough, and I had the answer straight away. And whether we were discussing the consequences of the Alpha and Delta variants, or the issues of intellectual property rights, or other pressing matters, you remained calm and helped to put even the most serious things into perspective. I quickly realized that we were in very able hands, because there is no virus that could really scare Peter. He's a pioneer in the fight against viruses. In addition, when it comes to global health issues, Peter Piot knows all the relevant stakeholders, most of them on a personal basis. His network, from scientists to politicians, from the heads of the big pharmaceutical companies to leading NGO activists, is second to none. This is what makes his advice especially valuable for policymakers. He has worked at the United Nations, the WHO, and at universities across the world until the London School of Hygiene and Tropical Medicine became his professional home. After more than 10 years at the helm of this wonderful institution, he is now stepping down as director. I know that he will be hugely missed there. But I'm very happy that Professor Piot continues to be my special advisor on COVID-19, and he will continue to lead the Commission's panel of national science advisors, because the next pandemic must not find us unprepared. During this crisis, we have seen what Europe can achieve together. Our European response to the pandemic has been united and strong. And dear Peter, this would not have been possible without you. I warmly wish you every success and every happiness for the future. And I look forward to continuing working with you. Thank you so much.
Hello, everyone. Thank you for giving me this chance to honor a friend, colleague, and public health pioneer, Peter Piot. From helping to discover and isolate the Ebola virus in 1976 to his innovative research and leadership in developing the global response to HIV/AIDS, to his time at the London School of Hygiene and Tropical Medicine, Peter's contributions to global health have been extraordinary. He's not only advanced our understanding of infectious diseases, he's worked to make sure it translates into life-saving innovations and made sure those innovations are shared around the world to save lives. As a senior fellow at our foundation years ago, Peter had a profound influence in shaping the direction of our work. I knew he was an impressive researcher, but what struck me was his insistence that we spend more time and resources on advocacy. He knew that bringing change meant engaging with governments and not shying away from policy debates. In that same vein, Peter's wisdom and guidance have been critical in organizing the global response to COVID-19. As a CEPI board member, special advisor to the President of the European Commission, and a first-rate scientist with decades of experience in the field. Peter, your research and leadership have changed the world. You've improved millions of lives and inspired generations of epidemiologists who will follow in your footsteps. As his friends know, Peter's an avid wine aficionado who, like a true scientist, keeps meticulous records of when, where, and with whom he shared a good bottle. Now that's great data practice. Peter, I raise a virtual glass to you. You pick the vintage as you return to your home in Belgium, and I wish you all the best in whatever comes next. Congratulations, and thank you.
I've had the good fortune to work with and learn from Peter in multiple roles. I'll just highlight three. The first was when I was in Department for International Development, as it then was, as Chief Scientific Advisor. Peter was remarkably good at giving clear, sensible, pragmatic advice about how we should actually address major public health problems around the globe, based on his years of working in Africa and particularly leading UNAIDS. The second has been as the leader of the London School of Hygiene and Tropical Medicine, where I've spent much of my career, and where I think he's been an absolutely outstanding ambassador for the organisation and the values that the London School brings globally. And the third is in domestic health, when I've been working in the Department of Health and Social Care. Peter again has given incredibly good advice continuously throughout my time in terms of how to address a whole series of both technical and small p political problems. And his wide insights into global health and domestic health really are unparalleled. So Peter, thank you so much.
Hello, my name is Marta Tufet, and I'm the Executive Director at the UK Collaborative on Development Research. I was truly honoured when Peter asked me to present at his farewell symposium, not only because of the immense respect that I have for him, but also due to the chosen topic. Equitable partnerships is something that's very close to my heart, and it has been at the centre of our strategy here at UKCDR. So I've been fortunate to interact with Peter throughout my career in research funding, from Ebola to implementation research. But Peter and I have worked most closely together for the past 4 years. Him in his role as the chair of the scoreboard, which governs UKCDR, and I as its executive director. And what I've enjoyed the most about working with Peter has been this shared vision to drive more inclusive partnerships. And in fact, I think that our relationship of chair and director has also been one of true partnership, and I'm certain that that's been central to our success. Peter has been a fantastic mentor to me, and his immense experience in global development, his passion have been invaluable to all of us at UKCDR. So UKCDR is a group of UK government departments and research funders working in international development, including FCDO, Wellcome, UKRI, among others. And our aim is to increase the impact of the research investments for global development by promoting coherence, collaboration, and joint action among these funders. And we have many tools at our disposal to support the funders. One of these is sharing learning and best practice. And for the past 4 years, we have focused on paving the way towards more equitable partnerships. And this is not just a moral imperative, but it's because when you bring equity into partnerships, the impact increases significantly. Research that is transdisciplinary, that is locally aligned, that is based on co-design and mutual benefit results in better outcomes. But important, it also widens the talent pool and brings in innovation. So we need equitable partnerships to tackle the complex challenges that we're facing today, from COVID-19 to climate change. In recent years, it's been fantastic to see so many new international partnerships being forged, but not surprisingly, there are still many inherent power imbalances. And in the UK, this has been compounded by the reduction of the ODA target, with projects and people under significant pressure. It's therefore even more important than ever that we understand and that we can articulate why equitable partnerships are crucial and how they can be supported. And there's a significant amount we have and that we can learn from long-standing institutions like LSHTM, which has such a strong track record in collaboration. And what we have learned that to be truly equitable, partnerships must be built on mutual respect and trust, on mutual participation and mutual benefits, and with equal value and recognition placed on each partner's contribution at all stages of the research process, pre-award and post-award. And so therefore, funders also have a role to play in this. Over the last years, there have been numerous efforts to set principles, to set guidance for funders, including our own report at UKCDR on this. However, as is often the case, there is a gap between this rhetoric and the practice. The activist in Peter has constantly reminded me that for change to happen, we need to mobilize from the bottom to the top, and importantly, that at the center of any debate, we must have global voices who have the contextual, cultural knowledge and insight to drive real change. And this is what we have been doing. We have brought this to the forefront, and we have worked with funders and researchers to broker this dialogue, to understand what are the remaining barriers, what are the enablers that will allow us to move from principles to action. And I'm glad to say that in response, many funders are already starting to reframe their funding calls to support excellence alongside equity rather than at its expense. And they're shifting their incentive structures to look beyond outputs of research, but also at how research is being undertaken and what support is needed for the broader research environment. For example, through their joint support of the good financial grants practice, or by ensuring research is demand-led. For example, our own work on housing with the joint UK-Kenya government scientific oversight board. Another hugely important area where we have been able to make a difference has been on safeguarding. When there is inequity in partnerships, this increases the risk of harm, whether this be harassment, abuse, or even sexual exploitation. Peter, alongside Charlotte Watts, also a UKCDR member, have championed and have aligned the major funders of our collaborative to make a joint commitment to raise these standards. And our subsequent guidance at UKCDR on safeguarding is now being used globally to inform funders, researchers, and communities to help them anticipate, mitigate, and address potential or actual harm. Now, when I first started at UKCDR, Peter told me to focus on data. Data is power, he said. It allows us to understand what works and to decide where the money needs to go. At the start of the COVID-19 pandemic, and with Peter very ill in hospital with COVID-19, I was reminded of these words, and I rapidly mobilized international funders to set up the COVID-19 Research Project Tracker as a tool to help understand funding gaps and areas of duplication in real time so that we could support a more coherent research response. And I'm glad to say that this has been a huge success. We have gathered data from over 200 funders across the world and have mapped more than 10,000 projects against the WHO's R&D roadmap. Sadly, what this dataset has also shown us is that even today, despite recognition of the need for context-specific research in LMICs, the global distribution of research funding for COVID-19 is largely skewed towards high-income countries. But Peter was right, data is power. So armed with this information, we have been able to influence funders both from the north and from the south to begin to pay attention to this reality and start to redress this inequity. To close, I would like to acknowledge that the road towards equitable partnerships is still rocky, but change is happening. We have the right footwear and determination. And as we're going down this road, we should remind ourselves that building trust takes time. It's a long process, and often the first relationships among partners will not be the most impactful, but they could lay the foundations for longer term and more fruitful collaborations in the future. Next month, I will be stepping down from my role at UKCDR after 4 extremely rewarding years, and I'll be taking up a new role as the head of policy at Gavi. I'm extremely proud of what we have achieved at UKCDR, and at the professional and personal level, I will be eternally grateful to Peter for his mentorship, his passion, his loyalty to vulnerable populations, and his constant reminder not only to think about global agendas, but also powerful regional and local agendas. And I hope to take all these values and lessons to my new role. Thank you, Peter, for your incredible leadership, for your support and friendship.
I am humbled to be a part of this milestone ceremony, celebrating the LSHTM's partnerships in the world and the achievements of Professor Baron Peter Piot as he hands over the baton to Professor Liam Smeeth, the incoming director of the prestigious London School of Hygiene and Tropical Medicine. Peter is a combination of 3 distinct valuable assets rarely found together in any one individual: a renowned scientist, a seasoned diplomat, and an outstanding people person. 3 accolades providing Peter with a unique leadership style throughout his successful career. He is not the conventional scientific leader, but more. And something tells me that his tenure as director of the LSHTM will long be remembered. Peter and I, as directors of the MRCG and the LSHTM, built on the well-established relationship between our 2 institutions. Senior scientists benefited from productive collaborations, whilst junior scientists completed postgraduate diplomas. With funding from the MRC UK, we created a fully funded postdoctoral program at the Gambia unit, 3 per annum, with 2 going to African nationals. On a more personal note, I have found Peter an excellent sounding board, partly because of his understanding of African politics, knowledge he acquired from the many African PhD students he successfully nurtured, and during his spell with the UNAIDS. The Africa Research Excellence Fund, a charity providing stepping stones for emerging African scientists, continues to benefit from his largesse. I have served in boards he chaired and enjoy his melange of good scientific knowledge, matched with strong diplomatic and political know-how. I am certain a new challenge awaits Peter, where he will again flourish. We, the retired but not tired, welcome you, Peter, to the world of active retirees.
Dear Peter, I would like to take the opportunity of this farewell ceremony to let you know that when I think about you, there is 3 different words that come to me. Number 1 is friendship. You have been an amazing friend of mine and many other people. But you have been, first of all, a friend of Africa. Since your first work on Ebola with Professor Liam Smeeth in DRC, you have been someone that has been always at the front to relieve the suffering of African people. And for that, I think we are all very grateful and feel honored by your friendship, at personal level, but at the continental level. The second word that comes to me is generosity. When it comes to generosity, Peter, you have been amazing with communities, making sure that capacity is being built, working out at UNAIDS to make sure that everybody get access to treatment together with your team. And I think this is a great tribute of your generosity. And you've been generous with your time, with your friendship, and also with your own resource to make sure that where people suffer in the world and where you can help, you're always ready. And I would like to thank you on behalf of Pasteur Institute for the time you committed to support our scientific advisory board and also help mentoring all these young people by giving them opportunity to find their way in the world and for their career. The third word that comes to my mind when it comes to you, Peter, is really what I would call mentorship. When I say mentorship, I have in mind talent. What impressed me the most about you, Peter, is that you have always been extremely good to find talent very early. You are an amazing judge of talent. And I don't want to bring names, but most of the leaders today on global health are somehow being helped to get to their position in their career. Because at some point, you decided when nobody knew them, that you would give them a chance. And that sort of mentorship is what is going to be important. And you've done that so many Africans that are today occupying very important position or are used to occupy very important position. Because you have been an extremely good judge of talent and detect them way before anybody and help them so much that now they're serving the country, they're serving the continent, and at the global level, they're serving everybody. And for all that, I want to tell you personally, I feel honored by your friendship. And there is one thing I'm going to ask you to apologize in advance because we won't let you retire. We still need your help. And we're going to be asking you so much help and support because we think you're unique and your uniqueness is to be a great and amazing scientist while being an extraordinary human being. Thanks for all you've done for us, for Africa. And we would let you rest a little bit, but we need you around us. Thank you, Peter.
Peter has always been a colossus in the world of global health, and he brought that gravitas to the LSHTM when he was appointed director. I can say without fear of contradiction that the LSHTM had an international flavour, definitely, before Peter came on board, but he most definitely put the global into the London School. From the corridors of the ICAP conference on HIV/AIDS in Melbourne, Australia in the early 2000s till today, I've admired the courage and the intellect of a man who is an adventurer and a true innovator. It takes true courage to face up to global leaders and speak truth to power when those without voice are dying in their millions due to greed and an imbalance of that same power. That was then, and now again in 2021 we face a very similar scenario, and yet again Peter Piot is ensuring that people live and not die. Only this time he is not in front of the cameras or in the forefront. Today he is doing what true leaders do. In partnership, he has passed the baton, but is running behind the scenes behind those with the stick, encouraging us, bringing the crowd along and the power alongside, and yet retreating quietly when the camera is on. Many here today will have no idea that when the vaccine delivery begins, COVID vaccine delivery finally begins across the African continent, that yet again Peter Piot was one of the main drivers and one of the main actors fighting for equity and health justice. I was honoured this year to deliver the LSHTM annual Women in Health lecture, and as an alumni of the school, it was perhaps the most important lecture I've ever given, but the partnership and the platform was afforded by the director. I had an opportunity to talk to so many young up-and-coming global health leaders, and maybe not the not-so-young alike, about the days when I would roll up to the front steps of Keppel Street on my husband's motorbike and how the LSHTM shaped my career and ultimately my life. Most recently, in this current COVID pandemic, it has been a privilege to work alongside Peter and to partner for global health at the Global Health Summit and for Africa as a whole as we have agitated for vaccine equity. I'm looking forward to many more opportunities to partner, not just in global health, but on the dance floors of Africa, from South Africa to Rwanda to Abuja and perhaps Addis. Thank you, Peter. Danke. Legends don't retire. They simply go on to new adventures and acquire even more legendary status. Africa thanks you, and we look forward to partnering far into the future.
Thank you so much for inviting me to celebrate LSHTM partnerships around the world as a farewell to Peter and a warm welcome to Liam Smeeth. My name is Rebecca Grace, and I'm the Director of Research at Epicentre. Epicentre was created by Médecins Sans Frontières, an international medical non-governmental organization, in 1986. Epicentre conducts field epidemiology, training, and research among and with excluded populations, either due to their remote location within a context of violence or due to lack of access to consistent quality care. Partnerships in research aiming to address public health needs, particularly those in epidemics, are arguably the most rewarding, but can also be fraught with challenges. They can be rife with power imbalances, poor benefit sharing, and lots of misunderstandings. But partnerships provide the foundation to move forward together to contribute knowledge and understanding to improve the lives of others, as well as our own. It's been a unique experience to work with Peter and all of those at LSHTM, particularly on projects responding to Ebola in DRC and Uganda. These partnerships take courage, humility, humor, and a grounded belief that partnerships only work when everyone benefits and everyone's voice can be heard. Myself and all of us at Epicentre are looking forward to continuing to work with LSHTM by taking opportunities when they arise. This is something that Peter did in an extraordinary way, and all the while recognizing, to quote Leon Trotsky, life is not an easy matter. You cannot live through it without falling into frustration and cynicism unless you have before you a great idea. That great idea is that, well, Peter's human, just like everyone else, and that's the most important foundation for any partnership. Farewell, Peter, and welcome, Liam.
Greetings from the Africa Centers for Disease Control and Prevention in Addis Ababa, Ethiopia. Since the establishment of the Africa Centers for Disease Control and Prevention 4 years ago, the London School of Hygiene and Tropical Medicine was and has remained a valued strategic partner. The London School was one of the first institutions to be visited by the Africa Centers for Disease Control and Prevention's leadership, as we sought at that time to gain knowledge and strategic insights on how to build a strong public health institution in order to safeguard Africa's health. Over the last few years, the Africa CDC and the London School have experienced areas of extraordinary collaboration, including in research, capacity building, resource mobilization, and much more. This is especially true as our institutions have worked closely together to fight the COVID-19 pandemic since the beginning last year. For instance, the London School is playing a principal role in Africa CDC's biobanking initiative and the Africa Collaborative Initiative on Diagnostics in order to scale up the use of antigen tests for COVID-19 diagnostics in African Union member states, thanks to the strong support of Professor Rosanna Pillins. As we began preparations for the eventual rollout of the COVID-19 vaccines on the continent, the London School served as a key partner for research through the Vaccine Confidence Project, led by Professor Heidi Larson, which is a joint COVID-19 vaccine perception study that spanned multiple African Union member states. On the topic of vaccines, London School has played a crucial role in resource mobilization. The leadership of Peter Piot was instrumental in the European Union's €100 million financial support to Africa's CDC's COVID response, as was the acquisition of the Johnson & Johnson vaccines, also facilitated by Peter. Outside of COVID-19, the London School has demonstrated its partnership for capacity building of African public health professionals through its support of the recently launched Kofi Annan Global Health Leadership Program. There is no doubt that Africa's CDC has grown since its inception, in part owing to the generous support and partnership led by Peter and the London School, for which we share our deepest gratitude. Before I end my remarks, I want to quickly say that Peter has been nothing but a true mentor, a colleague, inspiration, and brother to me all these years. I know I speak for many when I say that public health community is honored to have had you at the helm of one of the most respected institutions in our field. Your friendship, Peter, mentorship, and leadership will continue to inspire all of us. Thank you, Peter, for all you have done for the field of public health.
It's my great privilege to join you in celebrating Professor Peter Piot's extraordinary contribution to global health and the collaboration I've been privileged to have with this dear colleague and friend. We first met in the 1990s, working on HIV/AIDS, at a time when the disease was ravaging communities in Africa. Professor Piot stood out as a courageous advocate for science, equity, and solutions for treatments to reach the most marginalized at-risk communities. How this resonates today. I joined his staff at UNAIDS, and we worked hard on improving access to treatment for low-income countries and shaping the UN's joint action in countries, often settling interagency quarrels. From his early days tracking Ebola in the Democratic Republic of the Congo with Professor Muyembe and others, to mobilizing hundreds of the school staff to volunteer with WHO and our partners in the West Africa Ebola epidemic response, Peter is a formidable powerhouse in global health. As the chair of the WHO Ebola Science Committee, he shaped a research agenda to improve our understanding of how to detect, treat, and prevent the spread of this deadly disease. The London School's experts deployed to African countries have made impressive contributions in Ebola outbreak responses and the delivery of WHO's mandate. The school's emergency and epidemic data kit is a formidable information management tool that has been part of the response. Our colleagues work together on a daily basis in African countries, researching and innovating towards improving health outcomes for people here and globally. I look forward to continuing and expanding this collaboration with Professor Liam Smeeth and join others in welcoming him to his new role. We've had excellent experiences with the school students engaged as WHO interns and volunteers, and look forward to working together to provide more opportunities for experts from the Global South and African countries in particular to contribute to WHO's work on the continent. Peter, thank you for your infinite contributions from the global to the local level to build the evidence base for policy, to serve the vulnerable, and to save lives, building partnerships throughout.
Hello, my name is Fiona Watt. I'm Executive Chair of the Medical Research Council, and I'm delighted to be celebrating the worldwide partnerships of the London School of Hygiene and Tropical Medicine. Of course, we're here to say a very fond farewell to Peter Piot and also to welcome in his successor, Liam Smeeth. Of course, I don't need to tell this audience that Peter is a giant in global health research and implementation. And I must say, I have really enjoyed working with him since I joined the MRC. We've intersected in a number of different ways. One way I'd like to highlight is through his role as the first chair of the government committee to oversee strategic coherence of ODA-funded research. And he's been very effective in that role. But of course, our main partnership, if you like, has been through our two much-loved units in Africa, both of which are formerly part of the London School. So our unit in the Gambia represents a unique concentration of science expertise and high-quality research platforms in the West African region. And the research portfolio at the unit in the Gambia spans basic research to the evaluation of interventions for the control of diseases of public health importance in sub-Saharan Africa. And then our other unit, which is in Uganda, has the mission of adding knowledge and improving control of infectious and non-communicable diseases in Uganda, in Africa, and globally. One of the things that is really exciting about our units in Uganda and Gambia are their role in capacity building for research in Africa. And it's really exciting to see the talent which is emerging from those units. And of course, both units have played a key role in tackling the COVID-19 pandemic. And we in MRC are particularly proud of the role the units have played. But we're here to say a very fond farewell to Peter. And I would just like to say in closing that his insights, his intelligence, his focus on getting things done rather than simply talking about things are very refreshing indeed. And he will be sorely missed by me and all his friends and colleagues in the MRC. So very best wishes to you, Peter. Thank you.
Bonjour à tous, je m'appelle Hugo Kavunga, je suis chercheur à l'Institut national de recherche biomédicale qui est un laboratoire de santé publique basé en République démocratique du Congo. Et je voudrais par cette vidéo rendre hommage à un grand homme du monde scientifique, à un grand homme qui n'a pas hésité de travailler dans des conditions très difficiles pour l'avancement de la science et pourquoi pas de la santé publique. Il s'agit bien du professeur Peter Piot qui va devoir quitter la London School, qui après avoir travaillé en tant que directeur de la London School, va devoir prendre sa retraite. Et donc nous nous joignons à tous ceux-là qui aujourd'hui célèbrent ses départs. Il s'agit, nous rappelons que le professeur Peter Piot a travaillé en République démocratique du Congo depuis très longtemps. Ils ont fait connaissance avec notre directeur, le directeur de l'Institut national de recherche biomédicale, qui est le prof Muyembe, depuis 1976, quand ils ont eu à travailler sur l'épidémie du virus Ebola qui a eu lieu durant cette période-là. Et donc, depuis tout ce temps, le prof Peter est resté lié à l'INRB, lié au directeur, au professeur Muyembe. Et donc, nous entretenons de bonnes relations avec lui et je voudrais justement, par cette occasion, lui souhaiter un bon départ. Et n'oublions pas que la London School est restée liée à l'INRB, puisque actuellement, nous sommes en train de travailler sur un projet de collaboration. C'est une étude clinique vaccinale avec le vaccin GNG contre la maladie du virus Ebola. Et donc, vous voyez que le prof Peter et la London School est lié d'une manière ou d'une autre à l'Institut national de recherche biomédicale, INRB en sigle. Et donc, nous ne pouvions pas rester indifférents vu qu'il est en train de partir, il est en train de quitter la London School. Donc, nous voudrions par cette vidéo, effectivement, lui souhaiter un bon départ et nous espérons continuer cette bonne collaboration avec la London School. Merci et bon départ à vous, Peter. Bye.
Thank you very much for the invitation to speak during a special ceremony for Peter. It's a real privilege to be able to showcase some of the joint work that the London School and the National University of Singapore have been working jointly together. So perhaps it's useful to start off with talking about the School of Public Health in the National University of Singapore. We transited to become a full-fledged independent school in 2011, thanks to an endowment by Professor Swee Hock. But in 2012, that was when we signed our partnership, our strategic partnership with the London School, which promised to look after us like a big brother to a younger sibling. And they have actually been working very closely with us because, as you could see, Peter himself has been advising the dean of the school and as well as myself ever since 2011. And right now with Anne Mills taking over to advise us in the interim. So with all of this, we have been very privileged to talk about our alumni because we were previously a department since 1948, where we roll out our Masters of Public Health. And this has been our alumni, which included Dr. Margaret Chan. But I think it's more important to talk about what does the school look at right now? What does it stand for? And moving on in future, what has the London School been enabling us to work in Southeast Asia? So the strategic school direction that we have is actually centered around regionalizing the school, focusing on our role in driving and influencing the development of very sound public health policies in Asia, particularly focusing in Southeast Asia. Now, as part of that, we have an institute which we call the Leadership Institute for Global Health Transformation, which is really the setup that Singapore has as a way through an academic institution to contribute to global health ODA. And in this Light Institute, it's really our ability to enable us to look at how do we perform research, capacity building, as well as training in different parts of Southeast Asia. We have a specific strategy that is really centered around identifying which are the areas of needs in Southeast Asia, specifically focusing on occupational health and safety, focusing on enabling and developing capacity in healthcare financing and healthcare priority setting. We have regional offices in Southeast Asia, including in Cambodia, which is actually something that we benefited a lot from our partnership with the London School, because we started our Cambodia office 6 years ago. And 6 years back then, it was thanks to people from the London School, including Professor Richard Coker, that really enabled us and taught us what does it mean to have a regional office as part of a university faculty. So we have been very privileged to work with our local partners in Cambodia, in Phnom Penh, the University of Health Sciences, together with now the National Institute of Public Health, to really focus on a few key areas, starting in tuberculosis, looking at health systems, drivers, as well as other reasons for the development or the driving of drug-resistant TB in a country like Cambodia. But we've very quickly transited from TB to look more broadly at infectious diseases, particularly in antimicrobial resistance, now looking also in non-communicable diseases and occupational health and safety. We've been very privileged that this is now our 6th year of partnership in Cambodia, and generally we have been very successful at producing research grant funding to support the activities in Cambodia. And that has really led us to start our 2nd regional office in Laos, where the focus now is in maternal child health nutrition, looking at vaccine delivery, looking at improving and enabling the setup of sound health information systems that will enable Laos to progress in their public health and their clinical healthcare needs. So you could see that it is really through the partnership that we had with London School in Cambodia that provided us with the knowledge and the confidence to start our regional office in Laos. So moving beyond that, we are also focusing a lot in developing public health case studies, particularly of issues that are very relevant to this part of the world. For example, when we talk about universal health coverage, looking at what has enabled Thailand, the model that Thailand has to work very well, some of the issues that we face in terms of Vaxia in Philippines. Again, this was something that we worked with Professor Heidi Larson very closely to look into the issue of vaccine confidence. Many of these case studies have now enabled us to run executive programs in public health, as well as to use them in our Masters of Public Health Education. And this is, again, one of our development strategies for looking into research, as well as research filtering into education in global health. I will use a specific example of our partnership that has worked very well between the London School as well as the NUS School of Public Health, which is really looking at the problem of drug-resistant TB in Southeast Asia. And in Asia, TB remains a very big problem. And you could see that if we now focus on multi-drug resistant TB, Singapore is located within a neighborhood where there are many countries that are suffering from high rates of MDR TB. So jointly with the London School, we actually established a tuberculosis program. I talk about it in Cambodia, but beyond that, together with Professor Tani Clark and Professor Martin Hibbert, we were able to establish an ASEAN TB Genomics Network, which has raised more than $3 million of research funding. Beyond that, we also work on health systems evaluation, understanding what are the key drivers for drug-resistant TB to emerge in Southeast Asia. And of course, I talk about capacity building. We have been very fortunate in partnership with Mahidol University that we were able jointly to get a tripartite arrangement with the London School, Mahidol, and NUS to successfully obtain the Newton Fund support to run capacity building workshops in Thailand. So with that, I would like to end off with a very quick sharing of Peter's time in Singapore, where he provided us with the necessary guidance in outbreak preparedness. And I always like to think that Singapore, we have been able to cope with COVID-19. Peter has contributed that little bit to our national defense. So thank you very much, Peter. All the best to you. And thank you very much for the partnership with the London School of Hygiene and Tropical Medicine. And with that, thanks again.
Warm greetings to you all. I am delighted to share some brief reflections on Peter Piot as an esteemed scientist, prominent public health figure, and professional colleague, and importantly, a dear friend. Beginning with his landmark co-discovery of the Ebola virus in 1976, he has built a remarkable career as a leader in global public health who demonstrated an unwavering dedication to ensure the equitable distribution of safe, effective, and affordable treatments for people with HIV around the world. Peter's connection to NIH goes back decades. Early in the HIV pandemic, shortly before I became NIAID director in 1984, my predecessor funded Peter to lead a small fact-finding trip to Africa. For several years, patients had been traveling from Central Africa to Antwerp seeking treatment for a new and puzzling wasting disease. Peter's trip to Kinshasa was the first investigation of HIV/AIDS in Africa. It led to the creation of Projet SIDA, a 7-year joint research project between the former Zaire, Belgium, and the United States, resulting in seminal reports documenting heterosexual as well as mother-to-child transmission of HIV. It was through Projet SIDA that I first met Peter. Subsequently, our paths have crossed often as he went on to work with the International AIDS Society and the World Health Organization, and then when he subsequently became founding executive director of UNAIDS and served on the board of directors of the Global Fund to fight AIDS, TB, and malaria. At the UN, he elevated and became chief advocate for global action against HIV/AIDS. We discussed frequently how both the Global Fund and the United States President's Emergency Plan for AIDS Relief, or PEPFAR, could achieve their interconnected goals to close gaps in the implementation of HIV treatment and prevention. When Peter left UNAIDS to return to academia, his association with NIH continued. For example, immediately following the 2014-16 Ebola outbreak in West Africa, NIAID and the London School joined in a valuable multi-country collaboration with Liberia, Sierra Leone, Guinea, and Mali, and with the French research agency INSERM to conduct clinical studies of Ebola vaccines and related research. And most recently, of course, the London School has been a global partner with us in the research response to COVID-19. For his entire career, Peter has been fearless, passionate, and driven to reduce and, where possible, eliminate the pain and suffering of disease. His courage and dedication to this vision led to millions of lives saved around the world. Personally, I will greatly miss our work together, but we welcome and look forward to working with your successor, Professor Liam Smeeth. Peter, thank you so much. Stay well and all the best in your well-deserved retirement as director of the London School of Hygiene and Tropical Medicine.
I am Nícia Trindade Lima, President of the Oswaldo Cruz Foundation, Fiocruz, and it is an honor to participate in this event. First, I would like to congratulate Peter for his work as director of the London School of Hygiene and Tropical Medicine. During Peter's mandate, we were able to improve an extraordinary agenda for the historical collaboration between our institutions, which completed more than 120 years of public health contribution and innovation. We have been carrying out very inspiring activities and exchanges, addressing many pressing global health issues. These include epidemiological and data science innovation, health emergencies, infectious diseases, primary health care, vaccines, diagnostics, neglected tropical diseases, inequity in health, among other topics. In this regard, I reassure our will to continue and strengthen the existing partnership between our institutions, which points to a promising future to jointly address global inequalities and emerging challenges in order to achieve sustainable development with equity for all. Finally, I would like to wish Peter all the best in his new chapter of his life. You are leaving the school in great hands. And I would also like to congratulate Liam for the new position. I'm sure you will be very successful in the new venture. Thank you very much.
Peter Piot has not only been a celebrated leader of global health and a great champion of many worthy causes in public health, but he has been also a friend, philosopher, and guide to the Public Health Foundation of India. Almost from the very inception of PHFI, Peter has been associated with us as a member of our board. And he continued to guide us through many critical phases of our evolution. In defining the vision of PHFI and ensuring that we are following our path fully aligned to the goals of public health in India and global health overall, he has been both an inspiration and a great asset in providing us the right kind of direction. in building our institutions, especially the Indian Institute of Public Health in Hyderabad, he has been greatly instrumental in providing invaluable support. Many of our faculty have trained at the London School and have benefited again from the support provided by him. I have known Peter even beyond the Public Health Foundation of India in several initiatives at the global health level and have served with him on many committees. I've always admired the forthrightness with which he expresses his views, but carrying conviction with the clarity of his thought and ensuring that even people who had held different opinions earlier would be convinced by the rational arguments that he places forth. He has never hidden his opinions, but he has never hammered them either. And it is a quality that I still endeavor to learn from him in terms of how best you can build consensus without compromising on principles. I think after his retirement, he will become even more valuable to global health, because then he will be not only freer in time, but also uninhibited in his expression in terms of engaging on most important global health challenges of the day. And we in India, in particular, hope that he will give us more of his time in ensuring that PHFI can continue to benefit from his wisdom and gentle guidance. I look forward to a long and enduring relationship built on friendship, trust, and a great deal of mutual affection. So wish you the very best, Peter. I'm sure you have many more lamps to light on your way ahead. Thank you.
Ladies and gentlemen, my name is Koya Ryoshi from Nagasaki. This is my great honor to be given a chance to speak our progress in the past 9 years. Professor Piot first visited Nagasaki 2012. He instantly understood our ambition that Japan can do and should do much more to global health. Since then, he has taken his strong leadership in promoting this partnership with London. He declared this partnership as special, which really resulted in our getting multi-million subsidies from the government to build the first ever School of Tropical Medicine and Global Health in Japan. 2 professors are seconded, and we started 3 master courses of London Standard and also a professional DGMH. He gave a number of public lectures in Tokyo and Nagasaki and on website as well, which helped us strengthening our collaborations with other major institutions of global health in Japan, such as LSHTM and NIID. His lecture also influenced how Nagasaki local media viewing our building BSL4. He hosted a Japan-UK roundtable discussions, which I'm sure facilitated a new joint funding scheme. And then lastly, joint PhD. This innovative program attracted so many students and their supervisors to work together, expanded collaborations exponentially. We have now a special wide grant to support students. Personally, I have been extremely lucky to have had the chance to work with you and to have seen very closely how bravely you are working, how sincerely you are working. Thank you, Peter.
Hello, everyone. Thank you for inviting me to be a part of this special event and for giving me a chance to pay homage to a public health hero, Peter Piot. Many people have already sung Peter's praises today, and speaking for all of my colleagues at the Bill and Melinda Gates Foundation, we are so proud to join in the chorus. Peter has been a formative influence in global health for decades. As a pioneering researcher on Ebola, a leader who rallied the world against HIV/AIDS, a first-class epidemiologist, a diplomat for public health, and a true champion for women in global health. Since the subject of the symposium is partnerships, I want to focus today on how Peter has strengthened the many public health partnerships he has lent his time to, including much of our work at the Foundation. Whenever Peter visits us at Seattle headquarters, it is a homecoming of sorts. As he writes in his memoir, No Time to Lose, Peter first came to Seattle in 1978. Back when, as he says, there was a lack of good food or coffee. As anybody who knows Peter, he loves good food. There was only one Starbucks at that time. Then Peter worked under the remarkable King Holmes at the University of Washington, who has been Peter's lifelong mentor. Peter writes of the atmosphere of intellectual freedom and confidence at the Holmes lab, and Holmes' impressive ability to work with everyone across departments and disciplines at the University of Washington. Holmes' flair for team building and clear-eyed attention and guidance, even when he was busy or traveling, are clearly traits that Peter has passed on ever since, along with the many other lessons he had learned from 3 decades at the forefront of fighting infectious diseases. As Bill said, Peter was instrumental in pushing us at the Foundation towards a stronger advocacy role in global health. He encouraged everyone here to play a bigger role in public debates and to lean harder on governments and other institutions that could do more to help people in need. Since then, Peter has helped inform many public health partnerships we have joined, from the Child Health and Mortality Prevention Surveillance Network, also called CHAMPS, to the Coalition for Epidemic Preparedness Innovation, CEPI, which has been at the forefront of the COVID response today. Peter has also brought all of these essential attributes of leadership to many of these partnerships, and in doing so, he has helped to make them so much more successful. I have observed firsthand how Peter's political acumen and trusted pragmatic voice as the chair of the Independent Advisory Committee of the Institute for Health Metrics and Evaluation at the University of Washington has helped make them a go-to resource in the global health community for the global burden of disease estimations. I have also seen how, as vice chair of CEPI, Peter strengthened the world's ability to fight emerging infectious diseases at a time when too many governments and institutions were underfunding it. During COVID-19, with first-hand experience of this nasty disease himself, Peter refused to give up, and he has continued this important work at CEPI and in other fora as well, including as a special advisor to the European Union. And of course, as director of the London School, Peter has helped maintain the commendable legacy of this 122-year-old institution. We have been so proud to work with the school on many projects over the years, from improving maternal and child health and sanitation to fighting malaria, HIV/AIDS, working on women in leadership, and most recently on COVID-19. Even after decades at the pinnacle of his profession, all the hours in the lab, all the meetings with world leaders and health officials, and all the time in the field, Peter's never lost sight of the people he's trying to help, and he manages to find time to connect deeply with people across the world. I bet he has friends in every country of the world. In his book and his interviews, Peter often talks about the priests and nuns he met in the small village of Yambuku when his team was working to isolate Ebola. When establishing Project SIDA in Kinshasa, in the DRC, the first international AIDS research collaboration in Africa, Peter listened to the women at the sex workers clinic, and he was their champion from the earliest days of the epidemic. When people argued then that AIDS was only a virus of gay men, Peter insisted that was just not true. Viruses don't care who you have sex with. AIDS was a crisis for everyone. Last year, when Peter gave an interview, he also talked about the 3 men in his hospital room, one homeless, one from Bangladesh, and one a Colombian cleaner, all going through their own ordeal against this deadly virus of COVID-19. Wherever Peter goes, whenever he talks, he doesn't get lost in the data or the debates. He has a unique ability to keep the human dimension of public health front and center. Peter has also always recognized that defeating infectious diseases requires achieving related goals like universal health care, adequate nutrition and sanitation, and ending the systemic undervaluing of women and girls all over the world. More than anything, Peter's deep reservoirs of compassion and empathy, his love for his fellow men and women, the curiosity and joy that he brings to the world are what make him such a wonderful scientist, leader, and mentor. And since we're talking about partnerships, we also must credit Peter's most important partner and a fellow top-notch scientist, Heidi Larson, for his success. Thank you, Heidi. As partners, role models, and friends, you have meant a lot to everyone at the Foundation. I want to close with a note from one of my colleagues you know well, Trevor Mundell. Trevor says, over the 10 years I've been at the Foundation, the most valuable external advice I received on managing the problems of global health were in dinners I had with Peter and Heidi in various parts of the world at mutual global health conferences we'd be attending. I could tap into Peter's vast experience and acute insights over a couple of hours and a bottle of one of his favorite red wines in the most unusual of places, including under the railway tracks in Tokyo. Peter and Heidi, Trevor, Melinda, and Bill, I and everyone at the Foundation are so honored to know you and have partnered with you on so many successful projects over the years. Congratulations, and we look forward to whatever comes next.
Hi, everyone. Dear Peter, in the event of farewell symposium of Professor Peter Piot, chair or director for the London School of Hygiene and Tropical Medicine, I am very pleased to say a few words. I know Peter, of course, from his work and his leadership of the UOAs from the very beginning, but we never met. I vividly remember I first met Peter in Tokyo with our friend Iwamoto Sensei when he organized a meeting. And then I moved to work in China CDC, first as deputy head, and then now as Director General of China CDC. Peter, I know you made a great contribution for the science, for the virus discovery, and also for the leadership, for a strong AIDS control program. And also appreciate your long-term commitment to collaborate with China, especially my colleague, Dr. Zhou Xiaolong, who is the head of the National Institute of Parasitic Disease Control and Prevention under China CDC. You, as a director for London School, helped us to train a lot of young scientists, especially in HIV, malaria, cystic fibrosis, and you did a great job for China. You also helped us to set up so many programs for the AIDS control inside China. Peter, we are always your friends. We always like to work together. Welcome to visit China again, of course, after COVID-19. Let's work together, all my colleagues and friends in London School. That's the place for tropical diseases and emerging viruses. Let's work together. Thank you.
My name is Hiroki Nakatani, chair of the GHIT Fund, a R&D fund for entities based in Tokyo. I'm honored to speak at the farewell symposium of Professor Peter Piot. Peter and I first met in Yokohama, Japan, at the International AIDS Conference in 1994. He was fighting against the largest neglected disease at the time, HIV/AIDS. In 2007, I joined his fight as Assistant Director General of WHO in charge of HIV, tuberculosis, and malaria. Hence, we have been comrades for more than a quarter century. Our relationship was enhanced since 2018. Peter and I became the co-fighter against neglected tropical diseases at the GHIT Fund. Peter has served the fund as vice chair since its inception in 2013, and he provided outstanding leadership, unwavering commitment, and unparalleled wisdom on science, governance, and strategy. Also, Peter has constantly reminded us of the power of partnerships to overcome challenges. Japan appreciates his pivotal role in bridging Japan and the global health community. The Emperor of Japan decorated him with the Grand Cordon of the Order of the Rising Sun in 2018. Finally, Peter, congratulations on your glorious legacy at the London School, and good luck on your next journey. Please come and visit Japan once pandemic is over. We and your friends are all waiting for you. Thank you very much, Professor Peter Piot.
Greetings. It's an honor to join you in this celebration of Peter's many contributions to the world. You know, it's hard to get things done in global health. We need partnerships, of course, but they aren't always easy. Bureaucracy, turf battles, money, ideology, or simple inertia can all get in the way. Well, fortunately for all of us, these things drive Peter crazy. And this, in fact, is what helps make Peter so effective. Peter knows exactly how to get things done in global health. He understands firsthand the strengths and weaknesses of different stakeholders, and as you might have observed, he's not afraid to express his opinions. This is why we at Takeda have had such a great partnership with Peter over the years. He spent time with our employees to inspire them about global health and the importance of access. He's helped us to navigate difficult ethical questions as a member of our Ethics Advisory Council. And most recently, our collaboration has culminated in the launch of the Takeda Chair in Global Child Health at the London School. I've also had the privilege of working alongside Peter on the CEPI board. His lifelong focus on impact and equity, along with his deep experience in emerging infectious diseases, led him, among others, to call for the creation of CEPI in 2015. He's served on its board since then. Well before COVID-19, Peter understood CEPI would need strong partnerships across sectors to achieve its dual goals of vaccine development and equitable access. COVID only confirmed that and made clear just how much is at stake. Peter's been a consistent voice of reason on the CEPI board, while also pushing us to operate with urgency, focus, rigor, and inclusiveness, and always with people and equity at the center of everything we do. CEPI is now positioned to play a central role in taking future pandemic threats off the table entirely, thanks in large part to Peter's leadership. It's yet another way Peter has impacted the lives of so many around the globe. But that's just the latest chapter in an extraordinary career. I, for one, am looking forward to seeing what he does in the next one. Thank you, Peter.
First, I need to thank Peter for his lifelong mentorship, even until today. We started as a student when I first met him in Kinshasa, then as a student at the university, and for lifelong we worked together. First on HIV, we collaborated with Dr. Paul Janssen on the discovery of the first NNRTIs. Many of them failed. We worked ourselves through resistance. We came out on the other side with very impactful medicines. We developed together the first microbicides, long time later, leading now to the microbicide, the vaginal ring, which recently has been in review for regulatory 20 years later. We worked on HIV combinations over many, many years. And then on Ebola. Peter discovered the Ebola virus with his team, but we developed a vaccine over many, many years. First with a large clinical trial in Sierra Leone, where his team, the London School, was instrumental in executing on the clinical trial, leading to a vaccine for Ebola, which is now implemented on a large scale. Both in Congo, currently in Rwanda, but also in Sierra Leone and Guinea. Currently, again, the vaccine is needed to combat the current outbreaks and to prevent healthcare workers from getting Ebola. So, long-time collaboration between Peter, myself, and both of our institutions, Janssen and the London School, and we made a big difference in the world, Peter. And congratulations with your long career of visionary inspiration on how to make a difference for the world. Thank you very much for all you have done.
Well, it's a great pleasure and a privilege for me to say a few words about the emerging field of climate change and planetary health. And I'd like to start really by expressing my really profound thanks to Peter for his unwavering support for this emerging field, and to me personally. It's been an enormous pleasure to work with him over his term as director, and really his support for the work that we're doing has been absolutely crucial in allowing us to get to where we are with this topic in the school. So, as many of you know, this concept of planetary health really has been summarized as being the health of human civilization and the state of the natural systems on which it depends. So it very much emphasizes the importance of sustaining these natural systems in order to safeguard health. And we're now, of course, living in a new geological epoch, the Anthropocene. And it's been called the Anthropocene because it's very clear that the human populations are driving these very marked environmental changes that are occurring around us. This slide illustrates the great acceleration caused by a growing world population and the growing demands for fuel, for food, for shelter, for transport, and so on. And on the left of the slide, you can see the socio-economic trends. And undoubtedly, there's been enormous progress over the last, since the middle of the last century in particular. Life expectancies increased by over 20 years, for example. Now, there has been progress, inequitable progress, but of course, there's come at a cost. And the cost has been borne by the Earth systems, the accumulation of greenhouse gases such as carbon dioxide in the atmosphere causing heating of the planet. The oceans are becoming acidified. We're seeing widespread pollution of the water, air, and soils. And of course, we've exploited much of the domesticated land, about 40% of it, to grow food. And we've exploited the finite aquifers that store fresh water and cannot be replenished on human life scales. So what we can see really is that the health in the Anthropocene poses a whole range of challenges, complex challenges for research and action. We're dealing here with complex systems. These can have tipping points, non-linearities where systems change very rapidly. You can see that historically the Anthropocene is very, very recent, but it is now very dominant. There are delayed effects of these impacts, for example, of climate change. So by the time they become really apparent, it's often too late to act to prevent them getting worse. So we need to act now in order to forestall some of these damaging impacts. Of course, we need intersectoral action to adapt to and to mitigate these changes. And this requires also transdisciplinary knowledge. The old way of working in silos is not going to address some of these complex interlinked problems. And the school, I think, is very well equipped to undertake this kind of research because of its long historical involvement across a range of sectors and topics, ranging from basic research into very much policy-related research. So as well as articulating and defining the variable impacts of these environmental changes on infectious diseases, on nutrition, on non-communicable diseases, on mental health, we also, of course, need to shape and implement the solutions. So the solutions are of two types: adapting to environmental change where we can, and very importantly, mitigating. In other words, in climate change, cutting emissions. And when we cut emissions, we don't just reduce the risks of dangerous climate change, we also, of course, benefit human health. And that's because when we burn fossil fuels, a major cause of climate change, we also produce air pollution. Our transport systems are inefficient. They're polluting, they encourage physical inactivity. We should walk, cycle, and use public transit more. We need to move towards decarbonized energy systems. And of course, very importantly, to sustainable food systems and healthy diets, because food systems are driving climate change, about 30% of emissions, and of course, biodiversity loss as well. So there's a lot that can be gained by studying climate change, environmental change more generally, burgeoning planetary threats, but also the solutions to them. And of course, climate change and planetary health has a substantial history at the London School, which makes it almost unique amongst academic institutions. I want to pay tribute particularly to Tony McMichael, the late Tony McMichael, who was a great visionary thinker in this area. As early as 1993, he wrote this seminal work, Planetary Overload, which essentially articulated many of the challenges posed by these burgeoning environmental changes. And he contributed a range of other scholarship to this field of climate change and these broader planetary health issues that are summarized here. Most recently, of course, we've been fortunate to attract Wellcome Trust grants, the Chef's program on sustainable healthy food systems run by Alan Dangour, the CUSH, Complex Urban Systems for Sustainability and Health, and Paul's the lead at the school, and most recently the Pathfinder initiative, which aims to capture evidence about the health benefits of net zero carbon solutions. Co-PIs, myself and Rosie Green. So there's a lot that we can build on. And we're now, I think, at a great point, if you like, in history, because the threats have become apparent. There's growing interest in this area. And the school is particularly well positioned, thanks to Peter's support and the work of many colleagues around the school, to respond positively to these challenges. We can build on the Centre on Climate Change and Planetary Health, directed by Alan, the NIHR Health Protection Research Unit, Paul Wilkinson's directorship, the Collaborating Centre, the WHO Collaborating Centre on Climate Change, Health and Sustainable Development, co-directed by Pauline Shieldbeek and myself, and of course the very active Planetary Health Network, which harnesses the energies of early career researchers and students and organises a whole range of events such as the Planetary Health Week. So the school is really very well positioned to respond to these emerging and increasingly obvious challenges to human health, and also to play a key role in providing the research evidence that will drive the kind of policy shifts that we need in order to put humanity on a much safer course in this turbulent epoch of the Anthropocene. So let me conclude by thanking Peter again for his tremendous leadership and support to myself and many other colleagues around the world, and in the school itself, of course, and particularly for his support to this area of planetary health and climate change. Without him, we wouldn't be able to achieve the progress that we have achieved. So thank you very much, and we wish you every success in the future, Peter, and of course your creativity, I'm sure, will carry on, and your contributions to global health will continue in the next phase of your life. So thank you so much again.
Peter, I am delighted to have this opportunity to thank you for your extraordinary leadership of the London School of Hygiene and Tropical Medicine at this astonishing moment. It is a golden era that you have presided over. The role that you and your colleagues have played at the school during this pandemic has been exemplary, really showing the very best of science and scientists to inform not only policy, but also politics. The scientists at the school have really led not only the national, but also the international response to this pandemic. We, of course, at the Lancet have had many opportunities to work with you on commissions and series during your time as director. Work spanning fields such as HIV to planetary health, maternal and child health to Ebola. If I may add a personal note, Peter, I want to thank you from the bottom of my heart for your personal friendship over the years. You are a very interesting man. You're somebody with a strong vision about the part that health plays as a dimension of social justice. And unlike many leaders of organizations, your commitment to that sense of justice has been undiluted by time, responsibility, and power. So I would like to applaud and salute you for your ever sharper moral purpose. Of course, organizations like the school and journals such as The Lancet, we face many common challenges. We have to resist the conservative forces that are shaping our world, that threaten to set back the progress we've made in global health over recent decades. We have to advance the idea of public health and global health to make it more capacious and inclusive of social and behavioral sciences. We need to recommit ourselves to equity, diversity, and inclusion in not only our work, but also our leadership. And we have to create organizations that are very much about impact, not just meeting the necessary requirements of academic metrics. Peter, I will miss you. I hope that we can continue to work together in the future, and I wish you so very much good health and good fortune in what is to come.
Hello, I am Magdalena Skipper, Editor-in-Chief of Nature, and it's a great pleasure to be addressing you today. I was introduced to Peter by Peter's wife, Heidi Larson. It may be an unusual way to start my intervention, but having known Peter for a little while now, I am confident he will appreciate me saying that this is how we met. From the very first interaction with Peter, it was clear to me that here was an outstanding researcher, science diplomat, highly skilled negotiator, but above all, an extremely warm and easygoing person. Historically, Nature was focused on the natural sciences, and few clinical or public health papers used to appear in our pages. And I have to be honest, Peter has not authored many papers in Nature. This, of course, is our loss. Although he has written for us on a number of topics that are close to his heart, HIV, Ebola, and more recently on vaccination. I can also say that during my time in the role of Editor-in-Chief of Nature, both I and the journal have benefited greatly from his advice, which he has always given willingly. As Nature continues our transformation from being a multidisciplinary journal in the natural sciences to being a multidisciplinary journal across all disciplines of research, engineering, and medicine, I very much hope that we will continue to see many submissions from Peter, his collaborators, and of course from the London School and others in this field. I'd like to end on a personal note, if I may. In addition to sharing a passion for equitable access to healthcare, which right now, of course, is firmly focused on equitable access to vaccines, during the time I've known Peter, I discovered that we also share a passion for good food, African art, and Japanese aesthetic. Peter may be retiring from his director role, but of course he is not retiring as such. I wish him every success in his next chapter and already look forward to future collaborations.
Peter and all colleagues at the London School and around the world, it's a pleasure, but also a sad day to reflect on. 11 years as the head of the London School of Hygiene and Tropical Medicine, Peter. I don't suppose you thought for a second that you would be taking on the role of something for 11 years when you started. I remember a famous quote that, and I won't say where it was from, but you were moving from somewhere which took a more Darwinian approach to academic life. Famous quote I remember back in 2009 or 2010. It's been an amazing journey, Peter. You brought new strengths to the London School, built on its proud and long history, and you've made it better. And you've made all of us who've worked with you better, including myself, including the Wellcome Trust. But you've done it with great humanity, great humility, good grace, great sense of humour. And the number of times we've plotted together in the London School, in the street, in Wellcome, or over multiple memorable dinners, always with this bizarre habit of scratching off the wine label from both good and bad wine to record for posterity. 2010, Peter, Brexit wasn't a word. Obama was in the White House. President Trump hadn't even been considered. What a way the world has changed. And you've made an enormous contribution to it. Very best wishes to your next step. I'm sure we will be back in touch very soon, and we'll share those dinners again. And also a very warm welcome to Liam and the future of the London School of Hygiene and Tropical Medicine. Great wishes to you, Liam. You're following in great footsteps, but absolutely looking forward to working with you as well. So, Peter, farewell. Till next time, until that another bottle of wine at somewhere in the next few weeks, I hope.
Hello, I'm Liam Smeeth, the incoming director
of the School of Hygiene. It's a chance for me to say thank you to everyone for their contributions this afternoon. They were a little bit overwhelming to see, and they brought to mind the time when I just decided to apply for this post. And I bumped into a well-known academic who said, what kind of crazy person is going to try and replace Peter, this global figure, this leader who's taken the school to these amazing heights? They're not going to find anyone to replace him. I'll give it a go. I remember when, a few years into Peter's time as director at the school, I was head of department, and I decided to invite Peter along. And he said that he wanted to talk about something important, something in world health, and he'd come and give a talk about HIV. It seemed a good idea. I thought people would want to moan at him about the colour of the door handles, the toilet's not working, or they want a pay rise or something. But Peter came along, and he gave an absolutely gripping personal account of the HIV epidemic. It was a very humble, it was a very compassionate talk. It was had the audience on the edge of their seats, and led to some fantastic discussion. And we got to the end, and I thought, well, I better allow people to ask some questions and have a moan and groan about the place. And not a single one. I think people were too swept away with really this fantastic account, which really did sum up Peter and his achievements and what a time he's had over his professional life. A chance for me to say thank you to Peter, of course, for everything he's done for the school, from the whole school community. He'll be sorely missed, and I am really looking forward to some splendid dinners and excellent wine in Brussels. So thank you again, and goodbye, Peter.
On behalf of the court, I'm truly honoured to be asked to participate in this distinguished symposium and celebration of Professor Peter Piot. It was only 4 years ago that Peter and I got together, and he asked me to consider pulling the court back together for the school. Because as ever, the visionary, Peter knew that to create a global, sustainable, successful future for the school, to put it on strong footing, that we really needed to think about the financial future and the reputational future of the school. And thus the court was reborn. The court, of course, was easy to pull together because as ever, Peter led from the front with his energy and passion, grasping every opportunity, as he always does, to get out there, to enhance and attract a new network of supporters to the school, and also to lead from the front, traveling around the world, spreading the message, looking to diversify our financial footprint. Of course, the job, was enabled by the true quality of the faculty and the work that is ongoing every day on a global basis. The next generation of students that Peter cares so much about, and also the purpose, of course, of the school, never more exemplified by the world that we've all been living in for the last 2 years. Of course, as ever, as I've said, Peter led with energy and passion, but more than that, with his boundless humanity. And I think really in the last 4 years, that's what I've been struck by, and my colleagues on the court have been struck by: Peter's humanity, his passion for everything that he takes on, and his willingness to be tenacious and to take risks, to drive to places and to bring together people in ways that others perhaps could never consider truly possible. He is a wonderful visionary, as we have heard this afternoon. But also over the last 4 years, I've come to learn what a wonderful human being Peter is also. He has many passions in his life beyond global health and making a difference. We all know his passion for wine, horticulture, family, and of course, his passion and love for the wonderful Heidi. So I'll just conclude by saying thank you, Peter, personally, for giving me this wonderful opportunity to work with the school, with yourself. Thank you for your mentorship. Thank you for the role model that you are to the next generation, and particularly your passion for the next generation of women in global health. And above all, thank you so much for your friendship. I truly wish you all the best on the next phase of your journey.
Hello, everyone. I'm delighted and honored to offer closing remarks today as chair of the London School of Hygiene and Tropical Medicine's Council. I took the decision to join as chair of council about 18 months ago. And I must say it was one of the easiest yet most important decisions I've ever made. The direct impact on human health that the school has had and will continue to have is almost impossible to articulate. I'm both humbled and proud to be part of this amazing story. There is perhaps no better illustration of why the school is so relevant and needed than the COVID-19 pandemic. I'm proud of our multiple contributions here in the UK, in Africa, and globally. As we heard from today's speakers from around the world, the school has thrived under Peter's leadership in so many ways. The growth and depth of partnerships with institutions in a wide diversity of countries, with humanitarian organizations, with governments, with international organizations, and with business is now unparalleled in the global public health field. And there are so many other places where Peter's transformational leadership can be seen. Our communications and visibility in the media, the sharp rise in our philanthropic income, our policy presence and influence, and the establishment of several new education programs and research centers, such as the Center of Epidemic Preparedness and Response and the Center on Climate Change and Planetary Health. Our global footprint is unique for an academic institution with over half of its staff based overseas. We're incredibly proud that the 2 MRC units in Uganda and the Gambia are now an integral part of LSHTM. Peter's leadership here cannot be overstated. And lastly, it would be reckless of me not to mention the many enjoyable hours that Peter and I have shared working very, very hard on our shared passion of wine tasting. Peter, your skills are impressive, and it's my hope and my expectation that this aspect of our friendship will endure for many years to come. And now let me extend a very warm welcome to Liam Smeeth, whose combination of academic and clinical expertise perfectly places him to take forward our world-leading research and education programs together with our global partners. Liam, you and your team will write the next chapter of this important story, and I look forward to working on it with you. On behalf of the school, thank you for joining, and I sincerely hope you enjoyed the symposium today.